We
can't hear you. You have to put your mic on.
Yeah. So this is a 68-year-old male patient man who came with the complaint of diminution of vision in both the eyes since 1 year and with fleshy mass growth in the right eye since around 2 years. So on assessment, the visual acuity in the right eye was counting fingers at 1 meter. Am I audible? Okay.
Yeah.
Yes, we can hear you. Carry on.
1 meter for the right eye, and for the left eye, it was 618, which was improving on pinhole to 612. And tear segment examination showed pterygium grade 2 in the right eye and a cataract grade of NS3 dense posterior subcapsular cataract in the right eye and NS2 posterior subcapsular cataract in the left eye. IOP was within normal limits. Autorefractometry findings showed around astigmatism of minus 2.5 in the right eye. So we had advised topography for this patient, and the findings corroborated on the topography, where we found an astigmatism of around minus 2. More than 2.5, 6.7, around 2.67. And so we had planned the patient for pterygium surgery first and cataract surgery at a later date. So we'll be seeing pterygium excision with autograft and TCL glue.
So ma'am, I'll start the surgery.
Yes, please.
Yeah. So ma'am, I always prefer to do in my most of the 90% cases, conjunctive limbal autograft. And for the last 15 years, I always take my graft from the inferior part, not from the superior conjunctiva.
Okay.
The reason is this: the patient remains very comfort because there is less movement of the lower lid. Another reason is in the future the patient might require the trabeculectomy surgery, so we never know. So that's why we can save that conjunctiva and the PEPS. So I'll be showing you the inferior conjunctival autograft.
Okay, perfect.
And I'll be using the TCL glue.
Okay.
So now I'll start my surgery. First of all, I'll make a nick at the limbus. And I'll try to.
Can you just focus it a bit?
Center it towards you. Yeah.
Can you see?
Yeah.
Little bit more.
Little bit more.
No. The other side.
Other way around. Now we can.
No, because there is some disparity between the microscope and.
I think they need to put the inverter on because this must be set for the posterior segment and.
Problem আছে তোমার লোক কথা তো বুঝায় না no madam there is no problem হয়ে আছে so is it okay now ulta হয়ে আছে
slightly
inverted I think
inverted it is inverted actually that's why it's getting problem ulta হয়ে আছে you just change it is inverted you might No, it inverted है ना it more हाथ to ऊपर होता है it showing down it is inverted it has to be rotated so I'll separate the conjunctiva from the subconjunctival fibrovascular conjunctival mass at the limbus तुम धरा है
Yes, we can see it now.
तुम धरा धरा चेंज माঝে মাঝে চেঞ্জ করি থাকে না এটিও করতে পারবো so there is a fibrovascular mass which is there
yes
yeah we can see
so you can see this which is I'm separating there's big fleshy mass now once we separate it yes it is there once separate so while separating and doing this as it is very vascular so that's why there will be bleeding we have to cauterize and while cutting we must say that your medial rectus tendon should be this one. So the bleeding, cauterized. So there. ওই ওয়াশ দিয়া তুমি ধরা দিয়া ভালকে মাছ দিয়ে তুমি না এটু নহয় তুমি এটু দি ধরা মই থাম কেতে ওয়াশ দিয়া যেন
I think it is quite a big pterygium and it looks
Yeah.
very pretty also.
It's very fleshy and vascularized.
বন্ধ করা একবার একটু দিস ইজ বন্ধ করা একবার বন্ধ করা বলি কই মই ধরিব দিয়া না এটা so we have to hold the things they was there was then now swab দিয়া হেতু তো কই আছে মোর সার্জারি তো একদম মানে উল্টা করে দিছে একদম प्रभाते किबा किबी चेंज करे सब मन माथा में दादा जो भी है but अभी इधर now
I think now it is moving in the correct direction.
the now on
Yeah.
it's on
Yeah.
Yes.
देखा आपको गोल ओए माइक्रोस्कोप पे इतने गोल माइक्रोस्कोप यहाँ गोल कर लीजिए ले माइक्रोस्कोप इरिडिएशन है काटिबोदिएशन एवर एफ दिया vanus so once I have separated now so I think bleeding will stop slowly.
Yes.
Nothing to worry. So now I'll try to do the tracheorexis. I'll try to remove as far as possible. Try to rotate. Sometimes it doesn't come in one go. Sometimes it comes in the piecemeal. But I think so now Mehdi, oh, no. So I'll try to clean the no wash the swap. Mehdi diya. So I'm now wash the. So almost this is the clean. No much of tissues are left here. So cautery. Yeah.
So although it appeared to be very fleshy and angry looking,
Yes, ma'am.
it has come out in one go.
Yes, ma'am.
Yeah.
Yeah. So I think this is now measurement diya kuribokan. Now I'll do the measurement by the time. So this is almost the 5-7 millimeter. So I'll mark here 7 millimeter. It will be a marking kane. Koi shulu marker tetia man. So around 7 millimeter. So musidia. Yeah. So I'll just mark it here. So up to this down I can go because I may require around 4 to 5 millimeter maximum, not much. So just I'll hold it here. Give a nick and then I'll hold it. And now slowly I'll try to separate the conjunctiva and make it little deeper. So I'll hold it here. and try to expose as much as possible. Now I'll try to cut as much this one. Now, as per the marking, I'll try to do this separate.
So we cannot, can you just center it? Yeah.
Yes, ma'am. Is it
Yeah.
okay?
Yeah, now it is okay.
Yeah.
Oh, your microscope automatically it's moving. Why?
Yeah.
Why it's going?
Yes, now we can see.
Can you see, ma'am?
Yeah, yeah. we can
Yeah.
see.
Yes, ma'am. So I'm just separating the Mac person. So I'm just separating, and so it is already separated. Actually, I was pulling this. So I have just rotated it. And so now, aerosol दिया. I'll try just dry it out. दिया glue to एकदम. And so I'll try to so give me the instrument. So I'll try no next here. So just I'll dry. So now the different two components of the tissue glue. Now I'll use one component, any one component you can use on any surface. So I will the adhesive one I'll try to use so the which is little liquefied is I'll try to put over the surface. Yeah. And another, so this is which I am putting duta instrument main forceps. So I have put another portion on this and I flip it over. Can you see, ma'am?
Yes, yes, very well. We can see very well.
It's nicely rotated. I'll put it over this one.
Can we just move it towards your left side? Yeah.
Is it
Yeah.
okay?
Yeah, perfectly all right. Now we can see it very well.
You can see, ma'am.
Yes, yes.
Musi diya na yes. So now we'll try to say.
Yes. Now I think the bleeding is also a little less because the fibrin itself
Yes, ma'am.
retards the bleeding, the fibrin glue.
So can you give certificate this one? No, musibo diya. And glue diya. Yeah, give me some amount of glue. I'll try to put here. There one bundle. So I'll try to do this. So almost the surgery is that way is over, and the donor part we can leave behind as it will heal by itself. Or if you want, we can pull it and do the suture or even with the glue also. But in my last 15 years, I never suture. It healed by itself. So
Yeah.
there is no need to do. So this is absolutely wonderful. So there is no
Good,
need
yeah.
to do. And at the end, we can give DECA also, Genta, if you want, so to reduce the inflammation. So if you don't, we can give. But I prefer to give DECA, Gera while at the end of the surgery.
And what is your post-op regime in such cases?
My post-op regime is your antibiotic drops and ointment I give and pepper the FML drops, fluoromethylone drops, I taper it slowly, 4, 3, 2, 1 for a month, and one lubricating drops, this much. And
Right.
I continue it for a little longer, lubricating drops, rest I stop by a month.
Okay.
Sir.
Very nice.
So
Very
I
nice.
think it's absolutely, so
Yeah, the case was very, actually, it
Yeah.
was not a very easy pterygium.
no, madam,
It was
it's a
quite a
very
difficult pterygium. but-
it is a very fleshy mass I took to
Yeah,
show that, ma'am. Yes, ma'am.
Yeah, but it's looking, now it's looking very
now
clean.
it's looking very nice, very nice.
Yeah,
And
actually, the microscope setup, something has gone wrong, ma'am.
yeah,
That's why it was not because now. So now, hope it's. I could. If any question, ma'am.
no,
Anything?
no, not at all. You did so well, all the steps.
Yeah, ma'am.
You are very meticulous, Dr. Balmukund, whether you do
Thank you.
cataract or you do pterygium.
Thank you. Thank you so much.
Very meticulous and very clean and
Mm.
textbook like.
Okay. Thank you, sir. Thank you, ma'am.
Thank you. Thank you very much.